is Dr. Praveen Ramachandra. In this video, I will be explaining you about the why there is a problem with COVID-19 pneumonia patients with oxygenation and what type of oxygenation therapy is available to them. That will be my topic for this video. So, what happens in COVID-19 pneumonia patient means when the viruses enters into the lungs and they go into a place and damage the place where the oxygen and air and blood come together and exchange the oxygen. So this virus goes there and sits there and damages the place. So water gets filled into those places. Since the water becomes a barrier between the air which we inhale and the blood which comes to the lung for getting the oxygen, the water blocks the exchange. It becomes like a barrier. This is one reason why the blood oxygenation falls in COVID-19 pneumonia patients. And second reason is in the COVID-19 pneumonia, you might have heard already, there is many small blood clot can occur with COVID-19 pneumonia, and these clots can get lodged in the blood vessel which carry blood to the lungs for getting the oxygen from the air. And then when this blood clots blocks the oxygen, the blood vessels, then blood will not circulate to the place where the oxygen exchange occurs. So this is the second reason why the blood oxygenation levels drops. So when you call it is abnormal. So in the normal person, if the oxygen, unless he is a smoker or is inhabitant of a very polluted area, the normal oxygen level will be usually more than 95%. If the patient's oxygen goes below 95%, that means he is getting hypoxia, meaning low oxygen level. Anybody or any COVID-19 patient who is getting oxygen less than 95%, we offer them oxygen therapy. Now, normal air which we breathe that has 21% of oxygen in the air. But this COVID-19 pneumonia patients require additional percentage of oxygen in their breathing air. So we can categorize these patients into low flow and high flow. The low flow is given to the patients whose SpO2 is between 90 to 95% of the oxygen SpO2 level, oxygen level in the blood. So it's usually low flow means around up to 5 liters per minute. This we can give with a simple mask or a nasal cannula. But if the patient when SpO2 falls less than 90%, we may have to give high flow oxygen therapy. That is, we can give it the ventilator mask with the oxygen percentage of up to 50 to 60%, and that is a by ventilator mask. And we have non-breathing mask, NRBM mask, if that ventilator mask doesn't work, where we can give up to 80 to 90% of the if a fraction of oxygen percentage can be provided to the patients. And if the NRBM also fails, we switch over to the ventilators. Ventilators are two types. One is non-invasive ventilator, another is invasive ventilator. First we try non-invasive ventilator in these patients like HFNC, high flow nasal cannula machine, which gives oxygen up to 50 to 60 liters per minute. And another is a BIPAP machine, which gives inspiratory and expiratory pressure support and breathing support. If both of them doesn't work, we need to escalate into invasive ventilator, wherein we induce medical coma in the patient and we put a tube into the lung and we give oxygenation and pressure support. If that also fails, the option remains is ECMO. So in this, what happens is the blood is taken out of the body and the machine is there with oxygen is put into the blood and the blood is given back to the body again. So these are the types of or escalating types of oxygen therapy in COVID-19 pneumonia patients. Thank you.